Whether it's shots, pens, or an infusion, needles are part of life with diabetes. But what if just the thought of them makes your heart race? Today, Erika Forsyth and I are going to talk about the fear that's more common than you think, needle phobia. If you'd like to reach out to Erika, she's available at erikaforsyth.com. Nothing you hear on the Juicebox Podcast should be considered advice, medical or otherwise. Always consult a physician before making any changes to your healthcare plan. Don't forget, if you're a U.S. resident who has type 1 or is the caregiver of someone with type 1, visit t1dexchange.org/juicebox right now and complete that survey. It will take you 10 minutes to complete the survey, and that effort alone will help to move type 1 diabetes research forward. It will cost you nothing to help. When you place your first order for AG1 with my link, you'll get 5 free travel packs and a free year's supply of vitamin D. Drink ag1.com/juicebox. The Diabetes Variables series from the Juicebox Podcast goes over all the little things that affect your diabetes that you might not think about. From travel and exercise to hydration and even trampolines. Juiceboxpodcast.com. Go up in the menu and click on Diabetes Variables. This episode of the Juicebox Podcast is sponsored by Cozy Earth. Use the offer code JUICEBOX at checkout at CozyEarth.com and you will save 40% off of your entire order. Today's podcast is sponsored by US Med. usmed.com/juicebox. You can get your diabetes supplies from the same place that we do. And I'm talking about Dexcom, Libre, Omnipod, Tandem, and so much more. usmed.com/juicebox or call 888-721-1514. Erika, welcome back. It's good to see you.
Thank you. It's good to see you too.
We just finished up our short series on caregiver burnout, and we're jumping right into another sizzling topic, needle anxiety and needle phobia. You were nice enough to pull together some notes and thoughts. I've been doing the same. I've also put up a post in the private Facebook group. It's been up now for about a month. It got back about 50 comments about people sharing their needle phobias and stories and some things that helped them. So we're going to weave that into this conversation. But overall, I think that people with diabetes can get, I can't believe I'm going to say marginalized, but I think they can get marginalized around this because people just say, oh, you have diabetes. You must be fine with needles. Mm-hmm. That's it. As if having a needle phobia goes away if you have type 1 or type 2, which is just kind of silly, but definitely what I've seen in the world with Arden over and over again. Dentists, blood draws, anywhere where you intersect a needle, people just assume like, oh, well, you must be like totally cool with this because you have diabetes. But I don't think that's the case.
Absolutely. And I think one of the interesting research facts that I learned is that it's really common to have a fear of needles, needle anxiety, or actual needle phobia, which the technical term I also learned is trypanophobia.
Okay.
Which is the intense fear or aversion to needles, injections, or medical procedures involving needles. And if you have kind of the diagnosed trypanophobia, that is a specific phobia, meaning you have this irrational and overwhelming fear that goes beyond the normal discomfort most people feel about needles. Mm-hmm. But from this research, it says 25% of adults, 50% of teens, and 63% of kids are freaked out by needles. And that's from the Meg Foundation website, which I'll reference throughout our conversation, which is a great practical tool. But I just think, wow, that's a lot of us out there in the world, whether you're living with diabetes or not, that most of us, when we go and get our blood drawn, aren't like feeling great about it.
People aren't just like, oh, this is going to be awesome.
Right.
And why would you? I don't have a phobia. Like I have a procedure. I realize like if I get a blood draw, I've learned to breathe in during the needle being inserted. That was my thing. Like you inhale as that's happening and it lightens the pain. But in the end, you're at the you're at the mercy at how good your phlebotomist is a lot of times too. You know,
That's so interesting. I do the opposite, Scott. I've learned to breathe in, and then as soon as I feel the needle going in, I breathe out.
Oh, okay.
Right in that moment. Anyway, whatever works, right?
Yeah, exactly, right. And it's tough because I was getting blood draws a lot for a stretch back around my low iron problem, which I thankfully don't have to do anymore. But I found myself there a lot. And you really do learn that it is a crapshoot. The person who's helping you is either sometimes magical at it.
Yes.
Or it just feels like they're just like, rah, just hoping the blood comes out, you know? So I can see that being a problem. But anyway, this is a much larger issue than you would think. And I learned that reaching out through the Facebook group, but also to be candid, and I'm not going to overshare, but Arden has a pretty significant phobia, and I'm confident calling it a phobia based on her reactions to injections. So anyway, where do you want to start? Well,
yes. So I think just having an understanding that it is really common and there's nothing wrong if you have a fear of needles. And I also think it's important to note that while we're going to be speaking about this for the person getting injected, whether we're talking about IVs for a procedure or blood draws or site changes or injections for insulin, I also want to just note that parents who are having to inject or chase their child around or hold them down, you can also have a real traumatic experience as you're trying to save your child, right? Keep them alive. But in so doing, you are feeling like you're instilling this traumatic experience on them. And so we want to walk through some of these experiences and tools, but just that is so painful and so hard emotionally for you as the parent. So I just want to address that, and we will speak to that as we work through these topics.
Yeah, that's awesome. I concur. Have had the experience, so I know what it's like. Can I read this thing that you have here from the Meg Foundation?
Yes.
Pain is a biological, psychological, and social experience. On the biological side, the body's way of telling us something is wrong, to check it out. A nervous system sends messages to your brain. Our physical state impacts how painful something can be, like hunger, sick, or tired. So,
yes.
Okay. And then psychological, here it says pain may be worse depending on our mood. I didn't know that. And socially, how we react or view others around us impacts how we experience the pain. Wait, what does that mean?
Yes. So for example, I think as we talk about pain from this framework, that it's a biological, psychological, and social experience. With the social part, when your child is running down the street and they trip and fall and they skin their knee and they look at you as the parent, and if you are, we've talked about this even in the parenting series, right, overreacting and, oh my goodness, do we need to go run home and like over dramatize the situation, that child is then learning, oh my gosh, this is really scary. I really hurt myself. This pain is really bad. No, we're not encouraging you to be like, you're fine, get up, you're fine. It's finding that sweet spot of enough validation without over dramatizing the moment.
Okay. Well, that makes sense. And I've tried that while Arden is upset about an actual injection, and truth be told, it doesn't get us to the finish line, but it does. I don't know. I mean, the reason I brought this up to do is because after having this experience with Arden for so long, and then I was like, let me reach out and see how other people are feeling about this. And then getting so much feedback back from people, I thought, I know you have to do it to stay alive, but the minute that it doesn't become to stay alive, Arden will do anything to avoid it. She becomes the bad guy in a bad movie when he's caught. Do you know what I mean? She would do or say anything to avoid the injection. And she doesn't, she knows it's not making sense while she's doing it. It doesn't matter.
It's irrational.
Oh, she's begging for her life in that moment is how it feels. Really, it's really sad, but interesting too.
Yes. Yeah. It's so intense. And when we're going to talk through that, that fear that feels so consuming, but yet you can have an out of body moment and say, gosh, I know I'm going to be okay. I know it's going to hurt for a second and then it's going to be over.
Right.
But in that space of anticipation and fear can become so overwhelming and paralyzing.
Yeah. And it doesn't seem to make any sense because the second it's over, laughter will come sometimes. Just from abject fear to I can't believe I was that upset. she will tell me that part of the consternation in the process is that she understands how ridiculous it is that she's scared. And she's almost scared and mad at or embarrassed with herself at the same time.
Mm-hmm. Yeah. Yes, there can be so much shame attached to this experience. And I think it's important to understand as we talk about the pain, it's not just about the needle or the pinch or the site change pain, right? So, and I think also the physical state impacts how painful something can be in the biological realm. So if you are hungry, tired, sick, you're going to experience, your brain is going to send in the nervous system that message like, this hurts way more now because I'm sick and tired or hungry than if you are not those things. Just something to remember.
Yeah. Do you want to go through the causes of needle phobia?
Yes. So, and what we ultimately want to get to is when you are stressed, it's going to feel more painful. When you don't have any support or validation, it's going to feel more painful. And again, I'm talking about psychologically and physically. And so we want to get to a place of having more coping skills, and you will feel more in control of the situation. So that the causes could be a variety of things. Post-traumatic experiences, for example, you might have a painful or negative medical experience from a procedure. And someone referenced this actually in the Facebook group where they had a procedure and they couldn't find their vein with the IV and they were poked 32 times.
Yeah, that'll stick with you. Yeah.
That's a real trauma.
Yeah.
You are then probably going to have to work through that experience every time you go in for, a needle, a blood draw or IV. Learned behavior, observing someone else's fear of needles or hearing stories about bad experiences. So even now, as you're listening to this, just be mindful if this is becoming overwhelming for you as we talk about needles or hear us reference various stories and you already are in that space. Maybe pause, take some deep breaths, come back to this episode. You might just have a biological predisposition. You might just have a genetic tendency to develop intense fears, and it's being played out with the needles.
Interesting.
The vasovagal response, and some people also reference this experience in the Facebook group, that even the sight or anticipation of the needle causes a drop in blood pressure and heart rate, which is then going to lead you to faint and possibly vomit. And then when you have those experiences connecting to needles, that's going to reinforce, oh my gosh, this is a really scary thing. I'm going to avoid at all possible an engagement with the needle.
Yeah.
So those are some possible causes of needle fear or needle phobia.
Diabetes comes with a lot of things to remember. So it's nice when someone takes something off of your plate. US Med has done that for us. When it's time for Ardent supplies to be refreshed, we get an email. Rolls up and in your inbox says, "Hi Ardent, this is your friendly reorder email from US Med." You open up the email, it's a big button that says, "Click here to reorder," and you're done. Finally, somebody taking away a responsibility instead of adding one. US Med has done that for us. An email arrives, we click on a link, and the next thing you know, your products are at the front door. That simple. usmed.com/juicebox or call 888-721-1514. I never have to wonder if Ardent has enough supplies. I click on one link, I open up a box, I put the stuff in the drawer, and we're done. US Med carries everything from insulin pumps and diabetes testing supplies to the latest CGMs like the Libre 3 and the Dexcom G7. They accept Medicare nationwide, over 800 private insurers, and all you have to do to get started is call 888-721-1514 or go to my link, usmed.com/juicebox. Using that number or my link helps to support the production of the Juicebox podcast. This is from a listener. Thank you for introducing me to Cozy Earth. For my birthday, I bought stuff to update my bed, sheets, comforter, and a blanket. It honestly made our lives better. My husband and I used to have a conversation, in quotes, every single morning about who pulled the covers so far to their side or how we were too hot or too cold. That never happens now. Both of us sleep better and more comfortably. And don't get me started on the clothes. Y'all should just try one piece. use the offer code Juicebox at checkout at CozyEarth.com, and you will, in fact, save 30% off of everything you put in that cart. CozyEarth.com. Use the offer code Juicebox at checkout.
Should we keep moving?
Yeah, I'm going to share with everybody that I guess if people listen, they know that like Arden's been taking a GLP medication to help with her insulin resistance. And it's a self-injector. And it's funny because this is making a ton of sense because she was able to get through it. She said it hurts, and she would think about it for days before she had to do it. Mm-hmm. Like just physically, like, oh, I can't blink. And she told me, she's like, I'll think about it like days before it has to happen. I imagine the needle poking through my skin, like, like all this stuff. And she was able to get through it. But what we noticed recently is that as like other parts of her life became like unbalanced, she's having trouble like finding a school that she really likes to be at. Right. And as she's dealing with other issues, the needle thing became less and less tenable for her as it went on, to the point where she finally said, like, this is going to be the first week she's going to try Rybelsus, which is a pill, a GLP, which, I mean, hopefully will work, but likely will not be as impactful as the injected GLP. But we had to like tell her, like, okay, we'll stop doing it, because she was freaking out for days beforehand even. And it was just ruining her psyche about everything. But like I said, but for months and months and months before that, she was doing it on her own. Like, no problem. Like, she had a lot of trouble, like, mustering up to do it the first time. But then almost like she actually made a video of herself doing it the first time, which was interesting. And she shared it with us afterwards. She looked like a police cadet who was going to get tased for the first time, like working themselves up for it. Like, you ever see like a football player come out of the tunnel? They're like going crazy because they know they're going to hurt somebody and they're going to get hurt. And like, but they're just going to do it. You know what I mean? Like she literally
adrenaline. Yeah.
She's like, we're going to do it. Here goes. Click. I did it. Like that. Like, and that was the first time. And I wouldn't know that if I didn't see the video. And then from there, she managed it okay. She'd put it off sometimes a day later or something like that, but she was getting through it. But then when her life got kind of turned upside down a little bit, it became more difficult for her. So, I just want to kind of say that in like real world terms, what you've said here, I'm relating to all of it as this being her experience. But yeah, let's please move
yes,
past.
It makes so much sense, right? It's so connected to all the different systems.
Go through the symptoms of what happens when it strikes you.
Okay. And so these symptoms can be, as you said, for days in advance, she's thinking about that injection. So this could be occurring for you or your child seconds, minutes. We site change every 3 days, 10 days, right? That you anticipate the physical symptoms could be increased heart rate, sweating, nausea, dizziness, or fainting. I think someone in the Facebook group said it feels like like you're having a low blood sugar episode. Mm-hmm. The emotional symptoms could be intense fear, panic, feeling of dread at the sight or even the thought of the needles. And the behavioral, avoidance of the medical procedures, maybe skipping vaccinations, refusing blood tests, despite knowing that perhaps it's going to help you in the long run or for your health and it's important, you will avoid the interaction with the needle. Mm-hmm. And then what happens as a result, right? If you do have needle phobia, you might delay the treatment or the blood test or even, a surgery, possibly. Some people shared very vulnerably about that experience of wanting to avoid the needles it was so scary that you risked other components of your health. Mm-hmm.
Yeah, they're going to let other aspects of their health fall apart to avoid this needle thing.
Yes. Yeah. Yes, very real. Mm-hmm.
Yeah. I didn't realize how big of a deal it was. People, when Dexcom, I don't know what people are going to remember, but they used to have that inserter that was kind of like the clear tube almost that sat on an angle and you had to plunge it yourself and you could kind of see it all happening. And when they went to a self-inserter, like is on the G7, a lot of people are like, well, that's way better because you can't see the needle. It's such a big deal for me, they would say, not to be able to see the needle first.
Yes.
I guess it's just another one of those things. If you don't go through it, it's not going to make a ton of sense to you. You know what I mean? Like just unless it's the way it hits you, you'll just be like, it hurts for a second or it pinches. Or sometimes you hear people say sometimes it doesn't hurt at all. Depends on where it goes in or sometimes it stings. I take an injection once a week And I mean, I'm like the other day I realized I didn't do it. I was sitting on my desk and I was getting ready to go out and I went, oh, I should have done that. And I just yanked my shirt up and went click, doom. And I just left. I didn't think twice about it. And then later I looked back on it and I thought, oh gosh, like, you know, Arden's like, oh, let's do it. And then the needle comes out and then it's like a slowly I turn thing. And then she's just going in a different direction. Anyway, I want to say, like, if people are having these kinds of reactions, I know, like, some of you are like, you know, some people are using needles to dose insulin, like a lot of them are. But if you're having this reaction, it's a tough call because you got to do it. You can't not do it, right? But at the same time, I don't think that ignoring it or just acting like, oh, come on, it's not that big of a deal. I don't know. It's tough because I also take your point about, like, not making a big deal out of it. Like, you know what I mean? Like, you don't want to start like, because somebody's like, I don't want to do that. Of course they don't want to do it. Like, no one wants to do that. But if you just go, okay, well, you don't have to. Like, are you setting a precedence where it's not that, you know, oh, we'll skip this correction. Your blood sugar is only 180. We'll just let it sit like this for a few more hours because you don't want to do this. It's tough. I'm sorry. It's just another thing you and I talk about that I'm just like seeing both sides of it and neither side feels exciting. But I'm sorry. Go ahead.
Yes.
Move
No,
forward.
you're good.
Yeah.
I think just the validation of, like, this is really complicated and definitely in seasons of your life living with diabetes or with your child, it might feel like it's never going to get better. You're never going to get over it. Right. And if you have a needle phobia, it's not necessarily, we're not saying, hey, we're going to give you the steps to get over it. We are here hoping to validate your experience, but then also to provide some tools to help you manage your emotions, your physical pain through it. Shall we move into some tools and coping?
Yeah, please. That'd be awesome.
Okay. I know I've heard and seen a lot of people use the Buzzy Bee product. And on their website, they actually had a really great thing that I loved of making kind of addressing pain and the needle moment in a 3-prong way. One is to make a plan to address the anticipation or fear. And we're going to talk about that. And then 2, have a plan to manage the actual pain during the injection. And then 3, have something to focus on during the injection. So I'm saying injection for all needle examples that we've mentioned.
Yeah.
One of the things, the reason why we want to focus on that, it's a psychological experience, because what we are telling ourselves beforehand is so important. And obviously one of the treatments that if you are in a really needle phobia would be cognitive behavioral therapy, in addition to all the things we're also going to mention, but that would be really important to address. Do you have post-traumatic experiences from needles? And then how can we work through that trauma by also understanding how your thoughts and feelings are affecting your behaviors? That would be kind of on the more, perhaps not necessarily extreme, but more intense or severe needle phobia, as well as exposure therapy. Like, I was just thinking about, the picture that you posted with when you asked for.
Oh yeah, that threw people off even.
Yeah. So, and someone said, "Oh my gosh, that makes me scared." And I mean, it was an intense picture, but it did grab people's attention. And exposure therapy would be beneficial. Like, if you had a visceral experience or response to seeing that picture, that could be a cue to say, maybe exposure therapy could be helpful for you basically you learn the coping skills as you are exposed to that trigger.
Yeah.
So perhaps you're talking about needles and then you're working through the coping skills, and then you're envisioning it, and then you see a picture of the needle, then maybe you're holding the needle, and then you're giving yourself the shot. Those are kind of the therapeutic approaches. So the rest of the things that we're going to talk through are things that a lot of you already probably do, but we wanted to kind of leave them all here in one space. A lot of these things you guys referenced in the Facebook group and things that I do myself and that Scott does. So just not looking when it's happening. I know that seems really simple, but what you want to do is give your child or yourself the option. All of these things we want to give yourself and your child the control. And one of the things from the Meg Foundation for Pain.org website, they have great, you can have an app, have kind of a whole little plan, a printout. So as we go through all these things, you get to engage with your child or yourself what is helpful for me? So we're making a plan
Mm-hmm.
to reduce the fear. So do you want to look or not look when it's happening? And you have this discussion, but way before. And a lot of you probably already do this, right? Do you want to hold this stuffy or that stuffy? Do you want to do it in 10 minutes or 20 minutes? Do you, these are more kind of the actual tangible things, the shot blockers,
Mm-hmm.
which I've seen some pictures of. I've never used them myself, but apparently they are really effective, and they have like the little raised.
Yeah, they kind of.
Have you seen them?
They kind of confuse. It's like a plastic thing you pinch with a little bit. I guess it's got little like pokey plastic things that kind of confuse your nerve endings, right?
Yes. Yeah. Blunt skin contact points is what they call them.
Okay.
And so you push it down. I don't know. I apparently they're really effective. The Buzzy Bee is the vibration. It has vibration with a cold pack. I know a lot of people use that. The numbing cream, specifically Elma cream, is been referenced a lot. iPort from Medtronic is helpful for people for injections. Diaspider was a new product that I discovered upon researching for this chat. Apparently, I think it's for insulin pens. And it kind of looks like it combines elements of the shot blocker. Yeah, basically kind of like the shot blocker and total distraction. Are you looking at it?
I'm looking at a picture of it now, yeah. Oh, I see. So it goes around an insulin pen to kind of like give you the shot blocker feeling, like something touching and giving you that confusion. Plus it makes it look a little less like an insulin pen. Might be good for kids, like visually as well.
Yes. Yeah. And also has, you choose your color. Again, this is really to instill control and coping and choice, reduces that anticipation and fear, and then hopefully also simultaneously reduces that pain in the moment. Well, apparently being hydrated or not is really important for pain of the actual injection.
Plus, if you're doing a blood draw so that the blood volume's up and your veins are easier to get to, that can also be really helpful.
Yes.
I read about that too. Even just having someone drink 16 ounces of water before the injection, it almost like takes their mind off of it because you're like trying to get down 16 ounces of water, like, right? It just sort of, it takes your attention away a little bit. That's one I never thought of. What else you got on this list?
It's so good because you have a goal and you're focused on that drinking, and it's kind of a two-pronged positive outcome.
Mm-hmm.
Have a calm music playlist. These are a lot of things that people mentioned in the Facebook group. Laying down with your knees up, having peppermints in your mouth, ice pack on the back of your neck. We already talked about, inhaling or exhaling. Breathing is really important. Oftentimes we hold our breath when we're scared. One story that the founder of Meg Foundation, I wrote her name down here.
I'm just looking here, by the way. Cool flavor aroma of peppermint can redirect attention from the needle to the sensation in the mouth. Gives the brain something else to focus on, helping reduce the intensity of anxious thoughts. No kidding.
Yes.
Could also be grounding. Sucking on the mint can be grounding. Peppermint has calming effects to some people. Anxiety causes dry mouth. The peppermint can stimulate saliva production, making the person feel more physically comfortable. How about that? And because when you said that one, I was like, what? Peppermint. I'm sorry, I cut you off.
No, that's good. No, peppermint is well, not also peppermint, I think is good with like nausea too.
Mm-hmm.
You might have already just said that.
Oh, listen, I went to school in the 80s. If you went to the nurse and you didn't feel well, they gave you peppermint water to drink and then sent your ass right back to class. They're like, oh, you don't feel good? Drink this. Now get out of here. That was childcare in the 80s, in case you're wondering.
Yes. Peppermint cured all. So Dr. Jody Thomas is the one who created the Meg Foundation. Mm-hmm. And she shared this story as she was in training about breathing. And I just thought it was so great. I wanted to share it here also.
Please.
And some of these coping skills will work for you or your child for a couple months. And then just like anything else, you might need to switch. But the breathing, she asked the child, and you can do this for yourself as you're about to get the blood draw, envisioning a color that feels calming or comforting. And then think of a color that is like painful and uncomfortable.
Yeah.
And so the child said green. And black, green for comfort and black for pain. And so she, had her close her eyes and invited her to think about inhaling the green and images of green and then exhaling black, the color and feelings around it. And so I just thought that I liked that. We've talked about different breathing techniques, but I liked that one to share here.
It is important too, because I think when people tense up, they do stop breathing right away, which, a bunch of physiological reasons not to do that. But it's a nice idea. Like, take the good stuff in, let the bad stuff out, be visual about that. Like, in the end, I'm going to tell you something. I've tried a lot of this stuff with Arden, and usually what she says is, and we'll probably have to bleep this out, F you, that's not going to help.
Right.
But in fairness, I didn't have a lot of luck getting her to do the things. And so I did say, I'm like, I do think we should do some breathing stuff. I do think you should look away. She's like, I have to see it. I'm like, why are you torturing yourself? Like, she stares at it while it's happening. One time she said, I just want you to just do it, but I'm going to defend it if it happens. So somebody's going to have to hold my hands. My son came into the room and literally like held her wrists out in front of her while I did the injection. It was horrible, honestly. For all three, all three of us had a different horrible experience. But and this is a self-injector, Erika, it's like click and over. Like, it's that fast, right? And while it's happening, I hear, like, in kind of an amused tone from my son, she's biting me. and then it ended. She cracks up laughing and she's like, I'm so sorry. I thought I was biting my own hand. I couldn't even tell it wasn't me. Like, she was just looking for some, like, I don't know. Release. Yeah. Something. And I'm telling you that all of this took like 10 seconds, and it felt like we were fighting a war when it was over. Everybody was just like, we did it. But 5 minutes later, it was just like it had never happened. Like, she and I went out to do the next thing we were going to do, and it was just over. It was, I looked at her for an hour after that, being fascinated at where we were an hour previously. Just really something, anxiety and that adrenaline and the fear mixed together. It's bad stuff,
Yes. Well, but I love that she, like, part of, if you wanted to use the plan maker resource, it's beforehand going through, like, because she likes to look at it. And now, like, physical touch, your body, your brain can only focus on so many points of physical touch. And so, as oftentimes with parents, you might hold your child on their lap as they get their, immunizations or their injections, asking, like, do you want me to hold your wrist? Do you want me to give you a tight hug? Research shows that, laying your child down on their back and holding their arms down is actually pretty negative in terms of their medical trauma. They will probably have some medical trauma around that because you're so vulnerable and pinned down. But I also know sometimes you have to hold your child to make it happen. So just, if you can, holding them on your lap, wrapping arms around like you're giving them a big hug, but they're sitting up.
I wish that this would have been talked about when Arden was younger, because she was like a chaser around the house kid, and I do wonder how much of what's happening to her now is from back then, because all I knew to do was like grab her and do it. You know what I mean? Like, Erika, it's, you were injecting insulin. It was happening a number of times a day. And, sometimes she was cool with it. Sometimes she wasn't. But I do wonder how much of the process that we went through led to where we are now. And I'll never know. I'll tell you that before she went off to college, Arden hasn't had a correction with a pen ever. Arden's never used an insulin pen once. So she went right from syringes to Omnipod.
Yeah, me too.
Yeah. And you've never used it? No kidding. And so she stopped injecting when she was 4. That's when she got an insulin pump. And I've told this story before, but that a couple of years later, I wasn't sure if she had a bad site or something, but I wanted to inject insulin to check. And we got the syringe out, and she didn't remember it, which at the time I took really well. Like, it was a couple of years. She was maybe 6-7 years old at this point. She hadn't had a syringe in a few years. She's like, what is that? And I was like, oh, we're going to have to inject the insulin. And I just acted like, this. I've done this to you 10,000 times, And she had no memory of it, which I thought was great. And it was for a long while. But then all of a sudden, I don't remember exactly how old, but maybe a couple of years later, we were just at a blood draw one time, and she like climbed the wall almost in the room to get away from it. And then suddenly it felt like she overcame it, but she tells me in retrospect, she didn't overcome it. She was just like willing herself through it. She was having the same feeling every time. It wasn't until we got to this send her off to college situation where I said, look, I can't send you off to college not knowing if you can give yourself an injection if something goes wrong. I'm like, so your next bolus today, let's just draw it up in a syringe and you do it. She took that syringe and stared at it for 20 minutes and then eventually left the room. She locked herself in the bathroom with it. And she came out 45 minutes or an hour later. And she's like, I did it. But she looked like she just ran a marathon coming out of that room. Like, I don't know what she went through. She wouldn't let us in. She wouldn't let us help. She's like, I'm going to do it. I'm going to do it. It was an hour. And I swear to God, she came out. She looked like she'd just been through 3 rounds with a heavyweight. She was sweaty and disheveled and like, she looked half crazy. She's like, all right, I did it. And then that was the end of it. And I don't think she's done another one since then. It's been like 3 years. But anyway, and then people say, but there's a needle in the Omnipod. One of the great things about that Omnipod is you put it on, you pinch, you push the button, and it's between you and Jesus at that point. Like, it's just going to happen. You know what I mean? So you click and you just kind of wait. Mm-hmm. And she doesn't have any problem with the Dexcom inserter for the G7 either. She doesn't like it, and she flinches every time as if it's never happened to her before, which I've always found interesting. Like it never stops being what it is, if that makes sense.
Yes.
We're not through all your tools, though. I apologize.
Yeah, but she does. So, I think that's really common, though, for those of us who are on devices, CGMs, pumps, but to also, as you said in the beginning, to have an aversion to needles or blood draws or IVs insertions because it's out of our control.
Yeah.
And so there's something, and I think however you can set up, like, for example, going into a blood draw when she said she's crawling up the walls. I think the more you are able to understand what you need, even if you feel like it might not even help, but to then advocate for yourself in that way. Some of these, I thought these were really great examples of if you're able to get an appointment. A lot of people are not able to get appointments for blood draws, but to prevent the time in the waiting room while you're watching everyone else feel nervous, maybe you're hearing kids scream. Like, so if you can get a blood appointment or ask to be outside and get a text when your number's up.
Yeah.
For some people you can schedule it with the same nurse phlebotomist and develop that relationship. I actually just learned recently, my veins are hard to access for whatever reason. They like to hide. And so I know on my left arm, I know the vein that works. So for years I go in, I don't look, I point to the vein that works and they say, are you sure? I'm like, yep, just this vein.
Just do that one.
Yeah. And I look away and I do my inhale, I exhale when I breathe. But just this last blood draw, the nurse said, I'm noticing some scar tissue here. And I said, oh, why? No one's ever told me that. I just know that's the vein that's easy to find. So anyway, I said, is that problematic? She said, no, we just might need to use a smaller needle, whatever.
Erika's like, I need this spot to last at least like 40, 50 more years.
Yeah. So, and also to say when you walk in to sit down, if you know your plan, you can tell the person, hey, I'm not going to talk to you. I'm going to look away. This is the arm that I like. I need to lay down.
Whatever
so you're not in your
is.
head worrying. Yeah, you're not worrying about, do they think I'm rude or do they, it doesn't matter.
Right. Just give yourself less to worry about.
Yes.
By being prepared ahead of time.
Yes.
Yeah.
One person said this in the Facebook group, which I think is great. If you're an adult and you have children, but you're the one who's having to get the needle blood draw, have your child come with you because oftentimes that their presence might either calm you or you might have to stay more calm because you don't want them to see your fear. That I know that can be helpful sometimes.
This person in the group said that I used to pass out when I was going to get a flu shot and I'd feel kind of woozy. My dad would pass out as a kid from getting it. And so prior to having to get my first COVID shot, my mom took me to a therapist to do EMDR therapy. And I think that helped. Isn't that interesting? Like that's the pre-planning we're talking about. Also, the lady that did my COVID shot said to me, this is my first one. I'm a volunteer. And then stabbed me like we were in the middle of World War II and she's trying to kill me on the battlefield. And I was like, oh, wow. It's supposed to go in your arm, but down a little bit. I think she stuck it into my shoulder. I was like, what is happening? I was like, she got done. I went over to my wife and I was like, oh God, what happened? She goes, what happened? I said, she hit me in my shoulder. I should have known because 5 minutes before she couldn't figure out how to use the iPad. And I'm like, you all right? And she goes, this is my first one. We're all volunteers. And I was like, oh, okay. I thought that meant she'd be more careful. Not that she'd just swing like Jason in the Friday the 13th movies at me. It was not pleasant. But again, I lived through it. It was like
you lived, yes.
Yeah, and I also don't have a needle phobia. So in the end, I just had an unpleasant experience. I was like, yeah, that hurt. Like, what'd you do that for? And then like I was done with it. But if I was predisposed to this, that one experience could have put me down a bad path for sure. Because it was a really crappy experience, to be perfectly honest with you.
Absolutely. Perhaps had you been in a real, anxious space or fearful space, you maybe have the plan to say, I'm going to ask for what I need, and I need someone who's with experience.
Yeah.
I think we get nervous when we are nervous. We often feel fearful to say, you know what, I'm going to pass. I'm going to wait for this person over here who says they have 5 years experience, whatever.
I'm going to wait for the lady who knows how to open the iPad. That might have been like at least she's been here a day, I would think. Usually what I tell people in these situations, when they're like, oh, this is going to hurt, or I'm sorry, I go, I'm married. It's okay. I'm trying to make light, but
humor.
I've been through a few things. This isn't going to be the worst thing that's happened to me today. You should be around when my wife's yelling at me about something. This is nothing, or something like that, which not even true, but fun to say. But I do wonder in a real way, like it's just like the other stuff that we talk about where you have something, you don't have something. It's like when you're talking about somebody with anxiety, I'm like, it's so strange for me to listen to somebody speak with anxiety because I'm like, I just don't feel that way. And I feel lucky not to feel that way. But this is the same idea. Like, I know the needle's going to suck, but like, I just don't care. Like, it's going to hurt and then it's over. I don't even have trouble at the dentist. And I hear some people talk about going to the dentist like it's the worst thing that's ever happened to them, Anyway, I'm sorry. Keep going.
No, well, and speaking of the dentist, I think I was going to share an example recently with my daughter who had two cavities. And the first time we went, we didn't give her the laughing gas. Mm-hmm. And she was highly anxious. She said it was really painful. So we didn't do the second one. We went back a couple weeks later, did the laughing gas. It still was painful for her, but her anxiety and her pain scale was a lot lower. It's same procedure, same steps, except she had the laughing gas. And I think just our emotional state is so important to acknowledge in conjunction with the actual perceived level of pain.
Yeah.
Right.
I joked with Arden one time. I was like, you want us to try to find you some weed or something before we have to do this again? She's like, well, I'm starting to think like, what's going to help her relax before she has to do this? And I don't know if that would help or hurt or not, but my brain went there. I thought, is there something we should do to like get her a little loopy first? You know what I mean? Like, so I don't know. We didn't end up trying that, but anyway.
Well, and it's
I would have
okay.
taken the laughing gas
medication.
For sure.
Yeah. Pain medication or anti-anxiety, Xanax in the moment. Some people need that, and that's totally okay.
Yeah, I mean, if that's your situation.
You need to get something done, right?
Yeah,
like you need to do the thing to keep yourself healthy and to help find a way that works best for you is great. Whatever that may be.
I'm imagining people showing up at the dentist a little half in the bag going like, I was listening to a podcast. They said, sorry if I chilled out a little before this. But I do wonder how many people do that, self-medicate, stuff like that. I bet you more than you think.
Yes.
Yeah.
And it's okay to ask, right? Like ask your doctor, hey, I have needle anxiety and I have this blood draw. Can you prescribe me one Xanax? I think that's totally probably more common. It's something that people don't talk about.
Yeah.
This last one is the kind of correct term is applied tension technique. But basically, if you feel like you're going to faint, just squeeze your muscles, your leg muscles, your butt muscles, your abdominal muscles repeatedly while the needle is going in. It's keeping your blood circulating through your body.
Okay.
And will prevent you hopefully from fainting. So knowing and you can you practice that with yourself or your child. Okay, I'm going to squeeze my butt or my legs or my stomach. Mm-hmm. And we're doing 1, 2, 3. We're going to press the button. Any tool or tip to do beforehand, to talk through, to practice, gives both yourself or your child that confidence that you know what to do when the fear starts and when the pain starts, the physical pain.
What is this here? For adults, if you have kids, have them present to watch. And that may be, because parents feel like they got to hold it together in front of their children.
Yes. Oh. Yeah. So I think someone wrote that in the Facebook group. And so like this is for someone as the adult, if that helps, right? Because you want to be calm for your child. You're trying to model for your child, and having your child present as you're having the needle inserted. You're thinking about them. You're not thinking about what's happening. You're staying calm. That could be another tool. I mean, I don't know if you want to intentionally do that, but if it happens, that has worked for some people.
Yeah. Yeah, that's it. I mean, that makes sense to me. I mean, all these things, you got to pick and figure out what's going to help you for sure.
Yes.
But that makes sense to me.
And having the actual distraction when it's happening. We've talked about the medication, the mindfulness, breathing. I think we've covered most of the tools. And just honestly, if you're hearing this and you've experienced needle phobia or your child is, I really encourage you to not shame yourself or your child, particularly as maybe your child's getting older. You don't want to say, "Oh, you used to do this when you were a baby. It's time to grow up," or "Get over this, get over it." Telling this to yourself, like that is not helpful for yourself or for your child. And so to validate the fear that you're experiencing or your child's experiencing, and then to make a plan, I think is really, really helpful to help you get through the experience.
Yeah. I'm just going through everybody's feedback on the Facebook group, which I can't say enough thank yous for, because these people really being honest here. You know what I mean? I've locked myself in rooms. I've had irrational fears about needles my whole life. A lot of people do say like they passed eventually for them, which is as they got older. I've had minor panic attacks. One person says their kid passes out when they do it. That just happens every time. The kid, boom, just goes under. That's crazy. I've had needle phobias as a child back in the 1960s. Like this brought in people of all ages, shapes and sizes to make to say that this has happened to them. I just think it's very important what you said before, just to not act like, this doesn't really exist. Just because you don't feel that way doesn't mean somebody else doesn't.
Yes. And this is emphasized from the Meg Foundation for Pain website, that medical providers, they may only get 7 to 10 hours of pain management training in their schooling. And so while they want to help you and, treat you the best you can, for you to feel comfortable, knowledgeable, and empowered to ask for what you need. Now, we're talking about, when you're going into the hospital or labs, and then at home for you or your child to feel the same way, to be educated, to know what's actually going through, to make sure they know what's helpful for them. I think is so important, and was helpful for me to kind of refresh
to go through it yourself.
My memory. You go through this like, okay, what is helpful for me and what is helpful for my children, as we face these different experiences with needles.
The one thing that even I found like staggering is the person in the group that said like, I have tattoos all over me, but I can't give myself an injection. It's fascinating, really, just the way some people react to things and others don't. I'm super happy we did this because you found megfoundationforpain.org, which is a great resource people should go check out if they're struggling with this. I think whether you're an adult or a person trying to help a child, this would be a good website for you to look at.
Yes. And you're not alone. It is so common. And I hope that you find some help in this or the other resources.
Listen, I can just tell you from personal experience, it ain't no joke. Some of Arden's reactions, I can't believe they're happening while they're happening. Like really, I'm standing there, I'm like, what is, and it's so, you brought it up earlier, like, I don't want to make this about me, but it's hard to be in the room trying to facilitate this thing. Like, you know what I mean? Like when somebody says to you, no, I guess it's why I can't understand hurting another person. Like, because when she's begging for this not to happen. And I'm like, oh no, I'm going to do it. Not harshly like that. Like in your mind, you're like, no, we are going to get to the end where you are going to get this. And when it ends, you're not even going to care, which is like, it's even hard to wrap your head around. Cause like I said, 5 seconds after it's over, it's just over. But you're standing there I feel like I'm going to hurt somebody. I'm causing somebody distress. I mean, you're not, but it feels like you are. You know, you're having to do it for another health reason, but I don't know. But it's just of all the, diabetes sucks. I guess that's really what we should just say. Anything that makes you do this sucks but I hope you find a way through it. Like, I don't know how valuable we weren't in the last hour, but I wanted to do this because I just don't hear anybody else talking about it. And I knew a lot of people had to be struggling with it. So here it is. I hope it's helpful. You can go find some resources to get through it, or use Erika's idea where you just take a Zanny and then everything's okay. People are going to be like, hey, this lady Erika told me I took some wine. Now I don't have any trouble with anything anymore. Being serious, like if this was happening to you, like this badly, what do you think the steps are? Like after you've heard all this and been through all this stuff, like what do you think the steps are that you would take for yourself if this happened to you?
So if I knew that I had trauma, like, severe medical trauma, I would definitely be really intentional in therapy, whether it was EMDR or CBT, to work through and reduce my association with that trauma. And then I would be really clear with what I needed to get through each site change or IV insertion. So if it was that level, right? I was just thinking about, like claustrophobia. For people who are claustrophobic, I am, for one. And I know if I were in if I had to take an MRI or something like that, or I can do elevators, but there are treatment, whether it's medication or coping skills. So I think to think about needle phobia, like we probably hear claustrophobia more often than needle phobia, but it's okay. It's okay to take medication. It's okay to go to therapy for this. It's okay to know what you need, and it's okay to advocate. So I would probably start with therapy, know what my coping tools are, and feel confident that I could use those. And if that didn't work, then, maybe it is taking a Xanax for a blood draw, but maybe you're okay with your site changes. But I think it's really practicing and trying out different tools and knowing what works.
Going back in my experiences and looking back over the last however many years, I do wish that we would have taken Arden to somebody to talk about it. I didn't realize that it was going to stick to her like this, or that, and I think it maybe would have helped her to have talk therapy around it when she was younger, even if it was just specifically for the needle thing. I think it would have been time well spent. Looking in the rearview mirror, it seems that way to me, at least.
Well, no shame or blame on you as the parent. This is part of the journey, as a lot of parents have to go through. And it's never too late, right? Yeah. Like, it's not too late if she were open to that.
Yeah, sure. You go tell her. I mean, that's always the problem with getting people help on something like this, is that you have to explain, they have to agree to do it. And it's not always that easy. Like I tried to her. I'm like, hey, let's try grounding stuff. She's like, that's not going to work. I'm like, let's do breathing. That's not going to work. I'm like, Arden, the stuff people say this works for them all the time. She's like, just do it. But then at one point, she's just like, she was almost begging. She's like, we need to find a different way. And I'm like, well, I don't want you to feel. Then there's the other side of it. Like, you're having a ton of medical benefit coming from this thing too. So you're trying to find the balance. So anyway, we called it off for a couple of weeks. Now we're trying the pills. That actually starts today. And then we'll see how that goes. And if that goes well, then great. And if it doesn't, then hopefully, maybe, just like I said, maybe her situation overall in her life feeling better might lead her to go, oh, okay, I could try this again. So, but one way or the other, we got to figure it out, because she's not going to stop having diabetes anytime soon. So to me, this is it's a thing we have to figure out. So hopefully we can get her into a more accepting place. And then I'll bring up again, maybe going and talking to somebody about this, see if I can get her to do it. I'm not going to give up, but it's a long process is all I'm going to say.
It's a journey.
Yeah, for sure.
Yes.
Okay. Well, thank you again for doing this with me. I appreciate it.
You're welcome.
I'd like to thank Cozy Earth for sponsoring this episode of the Juicebox Podcast, and remind you that using my offer code JUICEBOX at checkout will save you 40% off of your entire order at CozyEarth.com. That's the sheets, the towels, the clothing, anything available on the website. The conversation you just enjoyed was brought to you by US Med. usmed.com/juicebox or call 888-721-1514. Get started today and get your supplies from US Med. I want to thank you so much for listening and remind you, please subscribe and follow to the podcast wherever you're listening right now. If it's YouTube, Apple Podcasts, Spotify, or any other audio app, go hit follow or subscribe, whichever your app allows for, and set up those downloads so you never miss an episode, especially in Apple Podcasts. Go into your settings and choose download all new episodes. Are you starting to see patterns, but you can't quite make sense of them? You're like, oh, if I bolus here, this happens, but I don't know what to do. Should I put in a little less, a little more? If you're starting to have those thoughts, if you're starting to think, this isn't going the way the doctor said it would, I think I see something here, but I can't be sure. Once you're having those thoughts, you're ready for the Diabetes Pro Tip series from the Juicebox Podcast. It begins at episode 1000. You can also find it at juiceboxpodcast.com up in the menu. And you can find a list in the private Facebook group. Just check right under the featured tab at the top. It'll show you lists of a ton of stuff, including the Pro Tip series, which runs from episode 1000 to 1025.